All right, so let's discuss an arterial line draw. I'm going to go over the vamp system, and I'm going to go over a three-way stopcock system as well. So everything should be within your field of view right here. You're going to have your A-line set up. This is the vamp system. In a real hospital situation, you have your pressure bag, what have you. I've got a simulated blood bag and a simulated saline flush bag. So I won't go too heavy in depth into the pressure bags or anything that's on those right now. More or less, just want to show you how to collect an arterial blood sample from an A line. Again, your indications for arterial sampling are going to be to assess the overall adequacy of ventilation and assess how well patient's oxygenating. So you may need to do this in order to assess whether or not changes need to be made to your mechanical ventilator, or if you've got a patient that's on BiPAP, or if you've got a patient that you're trying to decide whether or not they need to be intubated or what have you. So chances are, if they've got an arterial line in, they're probably in an ICU setting, or maybe come out of surgery or what have you. So with this particular system, what you're going to need to do, one, you want to make sure that you silence the alarms, because once you pull back on that syringe, you know, the pressure's going to drop. It may make people think that that the patients drop their blood pressure. So silence the alarm. Make sure that you pay attention to the way the stopcocks are turned and so forth. You want to make sure that you leave the stopcock so that the patient doesn't bleed out, because that would obviously be problematic. You're going to need a arterial line sampling kit. So we'll go ahead and get that out. So this happens to be a 1 cc syringe. And then I've got a little blue cap that I can utilize for my sample after I'm done with that. It's also got a heparin tablet inside of it so that your sample doesn't clot on your way to the ABG machine. And then with this particular one, you'll put your blunted needle on. So you'll need to get a blunted needle. I've already opened one. I've got a clear plastic blunted needle here that I can attach to the ABG syringe. Set that aside. So now what we want to do is identify our sampling port. This is our sample port, so you insert your blunted needle into the center of that. I usually support it with my finger when I do that. Anytime you access a line, you need to clean it with an alcohol prep. Some facilities might require that you clean it with chlorhexidine wipe, but you want to make sure that you clean that, pour it off before you access it, and then allow it an appropriate amount of time to dry. So now if I were going to utilize this as my sample port, what I'm going to do after silencing the physiological alarm, I'm going to do physiologic monitor alarm. I'm going to come over here and grab this inline 10 cc syringe, and what I'm going to do is I'm going to unclamp it, and now I'm going to pull back 10 cc's of waste. And you'll notice that that's, well, pink water, but should simulate blood. So I'll pull that back. And now once I've got my sample pulled back, I'm going to turn this stopcock sideways so that it is off, so that when I pull my sample out, don't run the risk of getting any contaminated blood that may be contaminated with my flush solution. So now I've got a pure blood sample that's in this line. So I've already cleaned the port. You've got your blunted needle. Now you'll take and directly insert that blunted needle into the port right there, and now you can aspirate however much of a sample that you want. I'm going to pull back about 0.5. That'll be plenty for me when I go run it. Now I'm going to pull that needle out. Sometimes with this being a pressurized system, you can blood may squirt out, so be ready for that. Recap your blunted needle. Remove it from the syringe. The little cap that came with your blood gas set, go ahead and remove any air bubbles toward the top that you may have. And I would probably put a finger over that if you're pushing that, because you could shoot that off the tip of there. And now your sample is ready to roll. So if you happen to have a cup of ice, set that on ice. You can clean your port off again. And then what you're going to do now is open this port back up, and then you're going to watch that line to make sure that you don't push in any air bubbles to your patient. And once you've given the waste solution back, again, watching the line to make sure there's no air bubbles that go in your patient because you don't want to cause an air embolism. What you're going to do now at this point is make sure that with this inline syringe that clasp connects. Because if it doesn't connect, it could bleed back into here, and then your line and catheter could clot off, and then you've got a situation where you've got to change or recatheterize the radial artery if you still need that. So once that's locked in place, you've still got blood from here to here, so you need to clear the line. So you can use your adapter over here, your pigtail adapters over here, and continue to squeeze those, and you'll want to squeeze them intermittently. And what you'll be able to do now is, as you're squeezing that intermittently, the line was really pink in there from where I had the blood in there, but you'll watch that blood clear or flush all the way back to the wrist. And then once you've got it clear back to the wrist, making sure there's no air bubbles that go in there, then you're able to start, because you obviously, every time you do it, you wouldn't want to give a whole liter bag saline bolus to your patient. So keeping that in mind, that is utilizing the VAMP system. So ultimately what can happen now is you may have a situation in which instead of a VAMP system, you got 2 stopcocks that get put in line. So ultimately you'll have 2 stopcocks that sit right here. The stopcock that is furthest away from your patient, so if this line is coming out of my patient, right here, there would be a stopcock proximal to the patient and a stopcock further away from the patient. So what I would do here is turn the flush line off with the stopcock that's back here. I would take a larger syringe and attach that to the stopcock that's furthest away from the patient, clean the ports off, luer lock that in, and then I'm going to withdraw 3 to 5 cc's of waste syringe, but I can leave that syringe attached, and then I will turn that stopcock off so that whenever I put my sample in, I'm no longer going to draw any blood from the waste syringe, but instead get it from the patient. So I would turn this stopcock, take your cap off, clean the sample port off with an alcohol prep, allow it to dry because the alcohol could skew your results, then luer lock in your ABG syringe, shut this off to your waste syringe. That way, when you go to withdraw your sample, it's going to be fresh blood coming from the catheter out of the patient's arm. And then you want to make sure that you turn this back off, undo that, cap that, get rid of your air bubble, and then you would go through and open this back up so that you can push the waste back in for your patient, disconnect your syringe, clean off the ports, and then flush the system again. Anytime you're attaching a syringe into a stopcock system, do make sure that before you press any fluid through, that you always pull back on the plunger. That way any air bubble that may be trapped here comes to the top of the syringe and you can watch it, as opposed to squirting one directly into the arterial system. You'll get a little bit more practice in class, but overall that's how we're going to utilize this system.